Hello everyone, I'm Dr. Durgaprasad Reddy, Head of Cardiac Sciences, Vydehi Hospital, Bangalore. We have done a lot of TAPVC repair in infancy. I have seen them getting into adult, they've finished their college and they've all got married and they all are having healthy babies. So there is no need to panic that TAPVC repaired children cannot go into adulthood and they cannot get married. They'll live their normal life once they get married. So always what I suggest is early detection and operation is key for this kind of congenital heart disease of TAPVC. So better awareness should be given. Early diagnosis by the cardiologist and early referral for surgery for TAPVC is the key. And once it's done at infancy, I think they lead a very good life. They can do all normal activities like other persons do. So take home message is early detection and early surgery is the answer for TAPVC.